Hello, everyone. Hi. Good afternoon, evening, morning, whatever it is in your time zone. We are here today with Alicia. Hi, Alicia.
Hi, how are you doing today?
We are here to talk about bones. And the main reason is that I would say that almost every second day, I have someone telling me that dogs should not get bones because they get splintered and they are dangerous and they're not good for dogs and all that. And out of the frustration of knowing that that is not correct and true, I sat down last night and I created a little uh, presentation about bones and why I feel that they can seriously extend your dog's life. So if you are watching this, I hope that you will not only watch and make notes and ask questions at the end, but also share this podcast or broadcast, not podcast, broadcast with your friends and those you care about. And we will also have a giveaway. And this time, because we're going to be talking bones and minerals, this time we're going to be giving away Green Mint, which is a mineral supplement and product. And I also will be talking about the fact that even if you feed bones, you may need to consider supplementing minerals, and that's what I do for Pax and myself. And will explain that later. So the idea of splinters came up in my mind, or in my opinion, as a result of veterinarians and other people who care about dogs saw bones causing serious problems in dogs. And they forgot about one thing, that in nature, bones are never cooked. In nature, no canines get a deboned chicken or deer. They eat bones. So the difference is between cooking and not cooking. Nobody would be really upset seeing a lion eating a carcass, right? And you can see that the lion actually is eating everything. And weirdly enough, not many people question, why do we tell dog lovers that bones are dangerous? We as a profession, as a veterinarian profession, while in nature, canines and felines, wild animals, eat bones. And the only difference is that it's raw versus cooked, because the cooked bones actually change in the digestibility. The chemical structure changes when books are cooked. Sorry, books bones are cooked. Now I mixed both of the words together. This happens to me as an ESL person once in a while, and who knows why. Anyway, so when bones are cooked, they become indigestible. And I remember this from our dachshund, Gerda. She was my sibling, according to my father. She had to go in a surgery because my dad fed her. He was actually a veterinarian. He fed her cooked chicken necks because he didn't know 30, 40 years back. And so he fed her chicken necks and she got an obstruction because those bones didn't digest. But the reason why they digest in the raw form is that dogs have evolved for that, lions have evolved for that. And I'm going to give you a little bit of a closer look at the digestive tract of canines versus herbivores. So if you look at the digestive tract of dogs, it starts in the mouth. And dogs have very much meat and bone grinding teeth. Like when you look at the carnasals and at the teeth at the back of the mouth, they're pointy and they're sharp and they're exactly designed, or they evolved to crack the bone. And in nature, wolves and coyotes and other canines will not be saying, "Oh, this shank bone will splinter and I'm not going to eat it." They will eat it because there's the marrow in them. And I know that from my dog Pax and my patients that they will eat those bones if allowed. And this is their natural tendency. And once again, it is safe because dogs have very strong stomach juices. The pH is 2, which is very highly acidic. If you were able to extract stomach juice from a dog and pour it on something, it would corrode. It would basically dissolve the bones. It would dissolve materials because it's so strong. So this is a little bit of a miracle when it comes to digestive tract of canines, because when a dog eats bone, for some reason, it doesn't go further. Biologically, dogs evolve, not for some reason, but biologically, dogs evolve for the bones not to go further until they're small enough. So they will digest in the stomach, they will dissolve, and there may be some small bits and pieces that go in the intestinal tract. But if you ever seen any gut of any kind, from a chicken or another animal, it is super tough. Like the stomach has very strong stomach walls. They get even stronger when dogs eat bones. So, they basically um, become more efficient in grinding bones and processing the bones, the walls of the stomach. When the bones go in the digestive tract, further in the intestinal tract, then the layers, the mucosa and the muscular layers of the intestine are super strong again. You would not be able to tear a gut of a dog very easily. Like it would take a lot of pressure or pull. Plus, the muscular layer contracts when there is a bone head hitting the intestinal wall. So basically, the small pieces of the bone that come from the stomach bounce off. And I have, in 30 years of being a veterinarian, 30 plus years now, I try to hide it now. I'm not sure whether it's it's good to be over 30 years. Anyway, in 30 years, I have not seen one single dog that would be affected by raw bone eating. I guess theoretically it may happen, and some colleagues say, "Well, I've seen that happen." Uh, I haven't, and I've had thousands of patients on raw bone diet. So this is my experience, and I think that whenever we are unsure, we have to go back to nature. We have to go back to nature, and our canines have not changed on the level of the digestive tract very much. If you had a German Shepherd and a wolf, and he did autopsy, and he took the intestinal tract from a wolf and a German Shepherd, you would not recognize it. The only difference is that there's difference in sizes, depending on what breed your dog is. But otherwise, it would be the same, and histologically, it would be the same. So, I think that part of the problem with the bone myth is that pet food companies have grabbed any single argument why we should not be feeding our dogs raw food or natural food. So the bone myth is one of them, right? And also it was reinforced by some people inadvertently feeding cooked bones, which resulted in problems and obstructions and other issues. Another reason to feed bones is that the stomach, as I said, gets stronger. And when stomach gets stronger, it's less prone to bloat. And there is an article on my website at peterdobias.com about bloats, gastric dilation volvulus, we call it in medical terms. And it is a condition that I have seen predominantly in dogs fed kibble, because these dogs do not get raw bone most of the time, and their stomach wall is very weak and flaccid. And kibble also has a higher tendency to ferment and produce gas. So when there's weak stomach wall and large amount of gas produced in the stomach or sudden movement, then the stomach will flip. Again, I have not seen that in dogs fed exclusively raw food, with the exception of one dog actually in my practice. Unfortunately, she died. I had a client calling me on Sunday morning very early saying, I fed my dog chicken carcass, and then I took it to throw a ball in the backyard, and it's really uncomfortable. And I said, don't even put clothes on, just go in your bathrobe, run to the emergency, because this is super life threatening. And the dog actually passed away. Again, you must not exercise your dog or let them play if you give bone or any kind of food, ideally. Like, it happens once in a while that I feed Pax and he starts playing, and I don't really like it. It's a relatively problematic issue. However, I also know that he is very strong and his stomach walls are strong. So I don't panic when I see him jump around a little bit. But I don't like it. So I try to feed him later in the day when I know that he's not going to be doing any exercise. If I know that there's a dog coming for a visit, then I would feed him later. Or I would even put him on a leash and a harness, of course, not a collar, and let him make him rest. Okay, so super important for you to remember these things. And again, pancreatic juices and the intestinal tract is shorter, the passage is shorter of the bones than in, let's say, herbivores when it comes to grass eating. And the other thing I want to point out, like if you oops, I don't really know what happened here. Oh, I know I focused the slides and now it just became all focused. Nobody gets really upset about seeing lion eating meat and bones. And we came as far as feeding our dogs grain and starches and carbohydrates, which is not really what they've been designed for. But it is kind of bizarre because if I came to a stable where there are a few horses and I brought, instead of apples, I brought them, meat treats or sausages, people would just go like, what the hell is going on, right? Like, did he lose his mind? But we're doing the same thing to our dogs. We are feeding them food that is not species appropriate, expecting them to do well. And even though dogs are much more omnivorous than, let's say, horses are, some of the arguments are totally flawed, and I would never recommend grain-based diet for dogs because I've seen it causing a lot of problems. Not only that the glycemic index is high, um, our dogs are simply not designed for digesting complex carbohydrates, and then they get all sorts of different digestive issues, from pancreatitis, weak stomach walls, digestive tract and intestinal tract microflora disturbances, all that comes along with feeding carbohydrates, and especially in the form of starches and potato starch. And some of the diets contain wood chips because that's good for weight loss. Of course it is, because there's no calories, and also it contains all the toxic resins and so on that definitely are not good. However, pet food companies think that it is okay to feed our dogs, and then they discourage us from feeding the regular good food. I've been feeding raw food for since the late 90s, maybe 1996, 97. Initially, I had one of my friends who I skied with telling me, "Hey, Peter, you should really try it because it works well." And initially, I was horrified, and then I started to see the differences and the results, and I never went back. Some of the transformations were just incredible. From a golden retriever. His name was Skokie, who was scheduled for an ear resection, basically removing surgically the ear canals because he had really serious ear problems and nobody knew what to do. And the specialist said, ear ablation is the only way to go. Um, he was rescued from the surgery by eating raw food. Within a month, he was almost back to normal. And raw diet is not a recipe for solving every problem, but it's a basically foundation. If you give your dog the right fuel, many of the problems disappear. Now, bones have several different purposes. Dogs love them because they can play with them. Dogs love them because they taste good. And dogs love them and chew on them instinctively because they are good for their teeth. And when you have a puppy, the play is super important because puppies like to chew on shoes and like to eat golf balls and leather and toys and everything. So bones will prevent puppies from um, getting into risky, dangerous situations. Also, it's super good for their teething and tooth development because the blood flow increases when puppies are chewing. So super important. Don't give your dogs plush toys that have microplastic in them and so on. I actually just recently got from a person that I really appreciate a toy for packs that is actually made of synthetic fiber. And I am just thinking, how am I going to explain that this Wild Pax loves this toy? I'm going to take it away very soon because I don't like it. I don't like him ingesting microplastic. I don't like the idea of us making it and all that. So, Bone is the best toy for a puppy, seriously, and the best toy for an older dog too. So play is one thing. Emotional health, like it's so good to give our dogs bone when we are busy, but make sure that when you do that, you always supervise your dog. Don't walk away when you give your dog bone. Some people give a dog bone and then they leave the house, but I have seen bone sometimes getting lodged in between the upper palate, basically between the teeth. They can, it can be problematic, and we'll talk about the different kinds of bones. Now, the second part is the food. Obviously, nutritional value is huge. Dogs get a lot of building blocks from the bones, and dental care. Dental care, in my mind, is one of the most important reasons why feeding bones can extend your dog's life. Because when dogs have infected, tartar ridden teeth, they will eventually suffer from immune issues, gingivitis, infection spreading in the bloodstream, affecting the heart valves, the heart function, and the kidney functions. Those are the main kind of side effects of bad, infected, abscessed teeth. Um, Obviously, another side effect is bad breath. And I must say that there are some dogs that suffer even socially with because of bad teeth. If you've ever been nearby a dog that is, I don't know, 13, 14, 15 years and has a really rotten mouth, and those dogs want to say hi and you're basically repulsed by the stench. It's crazy, on top of the infection that is really detrimental. And I can't really talk about dental care to the greatest detail today, but there's a podcast and also a video that basically recording from Facebook Live, previous Facebook Live, that we will post, and you'll be able to watch it. The only thing I wanted to say is that this is what healthy teeth should look like. I was actually going to take a picture of Paxie's teeth after 2.5 years of me feeding him bones and basically maintaining his teeth that way. However, my dear dog, I'm gonna be frank. What he did this morning, I'm gonna tell you a story. So we came from swimming, and I was swimming, and he was running and chasing his fish in the water. Then I tried to swim butterfly stroke, and he thought I was drowning. So suddenly I'm swimming, and suddenly I have this furry being in front of me, about 10 feet out in the ocean. I was really surprised because he never tries to swim with me, but he thought I was drowning. So he tried to rescue me. So I explained to him that I'm fine, that I was not drowning. And then we came home, and I showered him, and then I couldn't find him for about 5 minutes. I'm calling, and then I see him behind the fence. And the reason why he was behind the fence, somehow he crawled under it or something. But we actually, we have this amazing bone source. We have a hunter who hunts a deer that is an invasive species here, and we usually just skin it and portion it when the hunter brings it, and I put it in the freezer. But the carcass we don't know what else to do with it. We have this deep gulch that is basically just wilderness. So I just kind of bury it and throw it in there. But for some reason, he smelled it and he got close to it because when he came back, I smelt it. So I was with my camera wanting to take pictures of his shiny teeth, and then I go, I'm not gonna be going near your mouth right now because you are just into something very stinky. So that's why I couldn't take Pax's teeth, but I will post them eventually on Facebook. For now, we have this other image that I have collected, and these are teeth that are really healthy. You can see that the gum line is very healthy and pink, is not red, and there is no tartar buildup. And then it progresses. Then it starts with a little bit of tartar buildup, you can see. And the gum is a little redder around, and this is how it all starts. I would say that after a year to two of life, this is where dogs are. And then it gets worse, and you can see that there is some real serious tartar buildup and infection. And this is what I used to see in practice in dogs that are, I don't know, 8 years and older or 10 years and older. And this is such a burden on the immune system that I dare to say that this is going to rob a dog of months or years of life. And then these dogs have cardiac issues and people are afraid to put them under anesthesia. If your dog has teeth like this, there is no other way than you actually taking your dog to a veterinarian and doing cleaning under anesthesia. But there are ways of preventing it, and it is not toothbrushing from my perspective. Toothbrushing is really annoying. I think that it doesn't work. People try to usually brush off tartar and they spread the bacteria even more, because if you start brushing on this, guess what you do? You traumatize the gums. There's an open gateway of the bacteria in the bloodstream. You infect the heart, the valves, and the kidneys, and you have kidney disease and heart disease, and that's a serious problem. So anyway, uh, toothbrushing is, it can be a good way if your dog is okay with toothbrushing, but I see it being problematic. Therefore, go to my podcast on dental care and look at the whole podcast. However, with bones, you can prevent dental tartar. This is a picture of teeth that have been scaled professionally under anesthesia. But if you really get to it early and you know what bones to feed, you will be able to prevent major tartar buildup. And in my experience, with a little bit of dental scaling of the front teeth, which are the canines here, or here, I'm just going to show another one. Your dog will not need any dental under anesthesia. The reason why I say that the canines, the big teeth in the front, need to be scaled is that when dogs crunch the bones, they crunch them with the premolars, with the pointy teeth in the back here, but they don't crunch them with the front teeth. And I have not found any other way of getting rid of the plug and tartar on the canines except taking a hand scaler and the tool that dentists use, and scraping the tartar from the gum line down. You can also take your nail, and if the tartar buildup is very, very slight, you can actually take your nail and come from the gum line just below the gum and pull down, and you'll see that it'll kind of chip off. You can actually do that. I sometimes do that when I don't have a scaler. The only other thing that you can do is using coconut husks, not the coconut shell, which is really hard, but the green top. If you let's say get coconut that is grown for water and you see it in the store, it has the green husk on top of the nutshell, and that's very fibery. And I found that when Pax actually eats those, he really doesn't have any buildup on the canine teeth. So I know that you may have some questions about all this. We will give you an opportunity to ask questions. Right now, I'd like to do a quiz on bones, and I think that Alicia probably has some questions for you. And if not, we'll come up with something. or we'll go for one more slide and then Alicia will bring us a question. But the first quiz is going to be the first person that will answer on Facebook the question will get a bottle of Greenman, which is a plant-based mineral support for dogs. And you will be getting a coupon in the value of the product.
Excellent. Would you like me to read out my first question for today's quiz?
Of course.
Okay, great. I've made some notes. So the first question for the community of dog lovers that are watching is, Dr. Dobias, fairly recently in the slideshow, mentioned 3 key things that feeding bones can be good for. Who can name the 3 things? And we've covered them very recently.
And the first person who is the fastest typer, it has to be all 3 words.
Needs to be all 3, yes. And in the meantime, while I'm keeping a track of Facebook, Dr. Dobias, could you maybe dive into a little bit more about what sort of pain a dog would be in if it had the dental disease and the really bad tartar that you showed on one of those slideshows? Because one of our team members mentioned that a lot of dog lovers, unfortunately, don't understand the connection between the immense pain that a dog can be in when their teeth are that bad, because the dog is still eating. So they figure, well, it doesn't look good, it doesn't smell good, but there mustn't be any pain because they're still eating.
Well, first, Alicia, thank you for asking this question. First, what choices do they have actually than eating if they want to live? And obviously the desire to live for most dogs, or for all dogs, for most dogs, is very high. So they will do anything possible, and dogs will tough it out, but it doesn't necessarily mean that they're not in pain. If there is an abscess, if he had any dental pain, dogs are not any different. And with, imagine having that much tartar buildup and that much gum and bone recession. It's super painful. Dogs can completely change their personality when they have their teeth done and suddenly they're not in pain. So that's how you recognize it. But obviously, the longer you leave it, the less likely it is going to go back to normal. When you have gum recession and bone recession, especially when the bone recedes and is eroded by the infection, then there is really no point of full return to where it was before. And Sky, our first dog, was 16 years old when he died, and he had beautiful teeth. So it's possible. And I really highly suggest you to watch the dental care podcast. It's super important. One of the most important podcasts and videos that I recorded in my mind.
Absolutely.
So,
we have a winner. So our winner for the exact right answer based on the slideshow is Autumn. Autumn will be messaging you privately so that we can get in touch and set you up with your coupon for a jar of Greenman. Thanks for participating, everyone. It was great to see how quick people are on the computer.
So now we're going to go through the different types of bones and give you a little more practical advice what to do, because some of you are masters in raw bone feeding and some of you may have some questions. So if I'm repeating myself, for some of you, forgive me, but share the information with others who do not know as much as you do. So the 3 words are food, dental, and play. So these are the 3 words. And you can see that I divided dogs in 3 categories here. And under each category, I put FDP, food, dental, and play. The reason for that is that I have prepared, together with my team and our lovely graphic designer, Julia, this chart. And I will zoom in. It has all sorts of different types of bones and what they're good for and what kind of size of dogs they're good for. Okay, so I'll just zoom in. The first bone that people are really worried and afraid of are chicken bones, because again, the history of feeding cooked chicken bones and obstructions in dogs and so on. But chicken carcasses are really amazing for providing the right nutrients and providing the cartilage and all that, which are building blocks for joints. You can feed them uh, as as I said, chicken necks or duck necks or chicken backs, chicken wings, all that is good. Now, there's a difference what the function of these bones is depending on your dog's size. So you can see that chicken necks, duck necks are good for as food for dogs, pretty much all across the board, and as play for for small dogs. If you give small dog, little Chihuahua chicken wing, they'll be gnawing it they will be gnawing on the bone for some time. But if you give a medium-sized dog like Pax, I think that he's medium. He's about he's 60 pounds, so he may be somewhere between medium and large. He's gonna gobble it up. There's gonna be no play for him. Okay, the same thing for large dogs. Don't be afraid if dogs eat the whole thing, because it will digest in the stomach to the degree that it will be passed on to the intestinal tract when it's digested enough. So do not worry. There may be some dogs that do not have that have uh, genetic inability to digest bones. Okay, so you have to in that case they will most likely throw it up. Like if Pax eats a bone that doesn't suit him or is too big of a piece, he actually will throw it back up. Like I have never seen a dog getting an obstruction from eating a piece of bone that is too large. There are some bones that may be more dangerous for larger dogs, and I'll talk to you about them. But basically, the chicken and poultry and bird bones are good for everyone. You can see that the chicken backs, which are a little harder, may actually serve dental purpose for the small dogs. Okay, because their teeth are quite small, and if they crunch on the backbone of chickens and other poultry, they will have some scaling effect. Um, Chicken and duck legs and feet, again, pretty similar to chicken backs, right? Good for small dogs for all the three purposes, and then only as food for the medium and large dogs. Lamb shanks are one of my favorite bones, but also as I'm kind of learning about how how useful the deer bones can be, the spine bones, the backbones, the lamb shanks or deer shanks, any medium-sized kind of herbivore has crunchy bones, and they're super good for scaling those teeth because they're hard enough, right? And they do splinter when dogs crunch on them, and your dog will eat those kind of splintered bones. And despite all that, it'll be fine when he or she eats them. So they have their dental bones, their play bones, and I actually see that we have a little bit of an issue here because they should be also food bones. Some dogs eat them, and that is okay. So we may need to make a correction in this little slide. I would put a check mark for food beside lamb shanks for medium and large dogs, and the same for the beef ribs or any other rib bones, especially deer bones and goat bones and sheep bones. Sheep rib bones are good as food as well. So we've been working on this chart for quite some time, and I'm noticing still some details that need to be corrected. Now, medium knuckle bones. You see that I put them as play. Most dogs will not be able to crunch them, and if they can crunch these knuckle bones, I would say it can get to a point where for large dogs it can be dangerous for their teeth, because if they have a little bit of shank with the knuckle bone, with the knuckle, then the bone is actually harder and firmer than your dog's teeth. So now we are getting to marrow bones. They are not recommended for medium and sized dogs, mainly because they are too hard and dogs fracture their teeth. Again, when the carinasal teeth, the teeth in the back of your dog's mouth, are very pointy. And when the pressure is developed on that point, it actually creates too much pressure and it kind of slabs off. It's almost like slate that chips off. Like it really creates bad fractures, and I do not recommend marrow bones. Now, I never recommend any smoked bones from pet stores or any heat processed bones because they have to preserve them either with heat or some sort of preservative chemical. Never buy bones that sit in the basket at pet store. It is dangerous. Even for a small dog, I would not do it because these bones are infused with ingredients that we don't even that are not listed. And these bones are often sitting in the basket or wrapped in the plastic, and I never recommend them. The only time I would say bone marrow bones, the marrow bones are okay. Uh, Sorry, again, we have to make a correction here. The marrow is okay itself. It's the marrow bone that is not okay. So again, that is a little switch of the words here that we have to do. Anyway, so the marrow is okay, but the wall of the bone is too hard. For a small dog, for Chihuahua, well, they have it as a play bone, right? Like they'll be possibly dragging it around or chewing on it, licking it. That's all good. Quail bones, rabbit carcasses, all good. So, those are the bones that I recommend. There is another, there's maybe you'll ask, so how about turkey bone? Obviously, depending on the size, you can compare it to the large poultry or small herbivores such as goat. It can be, or it can be compared to, let's say, rib bone. Let's say if you have a turkey shank, thigh bone, it can be about the same size as a rib bone or maybe small lamb shank. Um, some people ask about antlers, and I have kind of reassessed my perception of antlers. In the past, I was a little worried about them because I thought that they were too hard. But the inside, when they're split, they're actually not too hard. So I would say that antlers are good for dogs that are mild to moderate chewers. For those who are really aggressive chewers and you give a dog a full antler, they can crack their teeth as well. But if they're split, many dogs or most dogs would just eat the antler marrow, and it is thought to be also beneficial for male dogs that are neutered because it does contain some hormones, some sex hormones and testosterone. So it may not be a bad idea, and I give it to Pax. The hunter brought me a few antlers, so I just have to go on YouTube and figure out how to cut them in half without cutting my fingers off. And Pax loves actually antlers. When we were traveling on the plane and when he was a puppy, he's a certified service dog. I'm a sleepwalker and I sleepwalked through glass door when I was in my early 20s and cut my major artery in my thigh by sleepwalking through the glass door and almost dying. So I am lucky that I can have a certified service dog, and Pax is trained to turn on the light and wake me up and hold me by my hand if I start sleepwalking and grab me and stop me. So it's all good. But he can fly, and when we are flying, he actually gets an antler to chew on because obviously I don't want to bring raw bones on board. That would be a little problematic. But this is an antler that is not cut, so I recommend it being cut longitudinally, long side, half. How do you say that, Alicia, in English? Longitudinally, or cut it in half, but the long way.
Yeah,
Along,
I
not
would
across.
say, yeah, cut it lengthways, like
Lengthwise,
across.
lengthways, yeah, lengthways, exactly. Thank you.
Welcome.
Okay, so there are a few different things that I'd like to point out. Ideally, choose bones from local sources, ideally medication free, antibiotic and hormone free, organic, pasture raised animals if possible. I know that this is sometimes a high order. I'm not saying that you can't feed other bones, but definitely do not feed bone meal as a replacement. And The reason for that is it often comes from places where we don't know what was mixed in it. It's heat processed. I've seen sometimes elevated lead levels from bone meal, and that's about it. You probably will be asking about bone broth, and I am not against bone broth, but I also know that bone broth is not the same as raw bones because some of it's cooked, obviously, and the minerals, some of them are bound in the bone matrix and they will not get into the broth. Some people swear by it, some people are neutral about it. I'm kind of neutral about it. I think it's okay. But what is also important to remember that the bone broth is only as good as the food of the animals that the bones came from. And that is a problem these days. Feedlot animals don't get the right nutrition and all that. Now, never cook bones or feed heat processed bone meal. Again, I'm emphasizing this because this could lead to emergencies. Cooked bones are indigestible. Uh, Always supervise your dog when they eat raw bones. Never leave them unattended. This is super important. As I said, I've seen some dogs getting their bone lodged in between the upper teeth, and that can be really obviously very traumatic. Imagine that you leave for work and you leave your dog with this kind of trauma for hours. It will really affect your dog's rest of your dog's rest of their life, mainly because it will be very traumatic. Um, the long rib bones are great for dental care, pretty much for all the sizes of dogs, especially the medium and large, because they can crunch them. But if it's too long and your dog is really greedy and swallows the bone whole, it may get stuck in the esophagus. It will not be swallowed really, like it will just, go in the esophagus, and part of it will be in the stomach and part of it will be in the esophagus. It would require an emergency. So if you know emergency procedure, if you know that your dog is greedy or gobbles up bones, give them either larger or smaller, but not long. Let's say, you measure your dog's throat. So if I had a German Shepherd that would be prone to digesting, or sorry, eating the ribs whole, I would actually give really large pieces. And I would also give small pieces, but not the medium sized pieces, because if they can't swallow it, it can be a problem. Um, what else? Going to share screen again. Oh. Now, if your dog doesn't digest bones or has many missing teeth, supplementing with green mint, which is the mineral support for dogs, is ideal. I formulated green mint in 2011 or 12. I was asked by one of the pet food manufacturers to come up with a replacement of bone meal because we knew that there was a issue with bone meal, and it has surpassed my expectations and also made me realize how important supplementing not only calcium but other minerals is. And the reason why I recommend supplementing minerals, even for dogs that get bone, is that the bones of the animals that the bones come from, are usually depleted of nutrients. We do not have balanced diet for most farm-fed animals. Maybe for the deer here on Maui, that would be different, but even then, they live in a certain area and you may see deficiencies of certain minerals in certain regions, right? In the past, these animals would be roaming vast distances in most cases, and they would not be restricted to just small location. Look at the wildebeest in Africa. They go hundreds of miles around, and they will probably have much more balanced diet. So if you feed your dog bones and you say, well, my dog does not need any supplementation of minerals, I suggest you doing hair key test, which is a hair test that I've been using for many years now to show people that if they even if they feed balanced raw food and bones, that their dogs can be depleted of some minerals. And I will show you an example of hair test, what it looks like. Oops, I hope I have it here. There's a link, and I think that I will have to switch my screen here. Just a second, because otherwise you will not see that. So hair test is actually a test that you can purchase and download on our website. You will get submission form by email, and then you send the hair sample to our lab. The results come with. Oops, just trying to share things a little more, and I can't seem to enlarge it. Okay, now it's better. So you can see that these are healthy minerals here. The essential minerals, the body cannot make one single mineral. So it has to come from food. And you can see that this profile is pretty balanced, but I actually tell people that if they do not give mineral supplement and their sample comes absolutely normal across the board, we will pay for their hair test because I have not seen that. So the conditions would be no mineral support or no green min and raw food or regular food and running the sample. If the sample comes back normal, I can pay for the whole test. And to be honest, I've never paid for the test because I always see some deficiency. So I know the option is there. Someone came yesterday and said, "Hey Peter, we have this in an article or on the product page, and shouldn't we remove it?" I said no, because I know I'm confident that this is not going to happen. And even if it happens, I'll be very happy and I'll say, "Hey, here is your money back because you obviously didn't need the test." So it's a good way to monitor, and obviously there are other factors that play a role in the mineral profile of each animal, digestive tract ability to digest, absorb nutrients, age, also drugs, certain chemicals that dogs are exposed to. This test also gives you an idea on heavy metals, on what heavy metals animals are. You can actually see this is a profile of a depleted animal that has really high chromium, some sort of probably industrial exposure to chromium, but all the other levels are really low. This is subnormal level. So this is a profile that I see quite often, actually. Um, let's see if there are heavy metals somewhere here. Do we have here? Let me just see if we, okay, here is actually one of the test results for heavy metals and toxins. You can see this is pretty good. There's nothing abnormal here, but I often have elevation in the arsenic when dogs are on rice-based diet, mercury when they're on fish-based diet or oils. Just recently, I had friend texting me saying that their dog, 2-year-old dog, had very serious abnormalities on the nose, on the skin of the nose, ulceration, lupus-like lesion, autoimmune-like condition. I asked them what they fed, and they said that they've been giving some fish. And I said, why don't you just take a Herky test and let me know? In this dog's case, the mercury was off chart or high, and strontium, which is also very common in dogs that eat sardines. And strontium levels have been increasing. I've been observing the increase since 2011 when Fukushima disaster happened. It appears that sardines absorb strontium the same way as other fish. The only difference is that the strontium replaces calcium, or it competes with calcium and deposits in bones, and sardines are processed and eaten with the bones. So that's the only difference. The strontium levels are the same in all fish, but in sardines, they're processed with the fish. Or if you get a can of sardines, people eat it, the whole fish, with the bones, and that's why strontium levels elevate. So the lesions are healing in this particular dog, but it's going to take some time because it was also put on prednisone, which is immune suppressive drug. And whenever prednisone is used in dogs and people, in my opinion, it decreases the ability to heal by about 10 folds at least. Like if I see prednisone in the history of a patient, then I know that it's going to be a really tough ride. So if anyone recommends prednisone or any other steroids to your dog, please be careful and ideally avoid them. And I have a lot of articles on that topic as well. So let's go back to what else did I want to show you? Yeah, I talked about the addition of minerals when dogs eat bones or if dogs don't eat bones. The body is able to sort the minerals out and store some that it's missing or use them, and the ones that are not missing excrete in urine and feces, and you will unlikely overdose any minerals when you feed bones and give supplements at the same time. um, I have seen such transformations in mineral supplementation because dogs cannot, as I said, produce minerals. We cannot produce minerals. We have to get them in food, and our food is not what it used to be. So I will just briefly show you what Pax and I take. Pax is taking the Canine Green, which is right here. It's a product that is well regarded and tried. 182 reviews on the US site with 4.96 review rating out of 5. If you go into the reviews, you will be able to see uh, what transformations people witness. And really honestly, I'm humbled by this because I never expected that it would be as pronounced and profound as what I'm seeing. Obviously, people like to complain when they have negative experiences. You would be seeing more negative reviews. This is actually one of our best rated products, and it's relatively simple, but it is the most effective in depleted animals because the mineral depletion is serious and real. And if there is no uh, supplementation, I see that it affects the general health of these dogs. So if you have a young puppy, you will not be seeing that as much as if you have a dog that is middle aged and older. And I just realized that you did not see the product because and all that. So this is Greenmin. You can see it at my website peterdobias.com, greenmin.com, and here are the reviews, 4.96 out of 5. We publish all the reviews. I remember the first review that we got for Greenmin was a lady who actually complained, who gave the product 1 star, and it was because it stained her dog's beard green, so she didn't like it. If you do not like the powder form, which most dogs actually really love, there's a capsulated form for humans. And the reason why I came up with the human supplement is really simple. People and my family and I was taking the dog supplement, and then we sometimes capsulated it because it was, the flavor, the taste is good for the dogs. Love it. People don't. I don't like spirulina flavor. So the human green mint is slightly different. It has actually wheatgrass in the formula. Otherwise, the formula contains alga calcarea, which is mineral-rich algae, and you can read about it on the product page, and also spirulina as a source of amino acids and essential amino acids, actually. So if your dog doesn't like, or if you don't want your dog's beard to be green, most dogs don't care and most people don't care, and you can wash it off. But if you have any concerns, you can give your dog the green mint for humans as well. And this is what I take now. We're really proud that all our products are packaged in glass and they don't have any plastic lids anymore. And we ship them in these eco sleeves, which replace bubble wrap and plastic. So we try to be as responsible as possible. I know that many of you appreciate it. So I think that we are back to, we have three more products to give out. So we'll give two Greenman H, which is the human ones, for those who live in the US. And for those who live in Canada, we will be giving only Greenman for dogs. The reason for that is that we are not approved yet to sell the product in Canada because the product is very cumbersome. However, we are coming up with some new and possible ways for you to be able to order the product from our US company personally for individual use. You may be able to do that, and we'll give you some instructions within the next month, I'm just going to say. So keep in touch and keep an eye on the website and on the newsletter. If you have not subscribed to the newsletter, please do, because I publish information every week on how to keep your dog healthy, and now been kind of also publishing a lot of information on human health and longevity. Obviously, I'm human. I'm interested in that. I have a medical degree, even though it's a veterinary degree. I've been interested in human nutrition and well-being and healthy lifestyle since I was 19 or 18, since I cured my allergies with healthy diet. So yeah, keep in touch. And Alicia, what question do you have next?
Sure. So for the next question, I'm going to make this a little bit trickier because everyone was way too quick the first time round. And I must say, Karen, thank you for mentioning. I didn't actually give the answer when I mentioned that autumn won. So the answer was food, play, and dental. Those were the three things that bones can be good for. First question for the next jar of Greenman will be the stomach acidity. Dr. Dobias mentioned earlier that the stomach of our dogs is highly acidic. Can anyone remember what the pH is that Dr. Dobias mentioned at the very start of the presentation? I'll leave you with that. And then I have another question straight after. So I'm going to keep an eye on answers.
Why don't we just do one question,
Sure.
maybe? Yeah, why don't we just do question?
Yeah, we absolutely can. One of the questions that has come up from Hepatia is, do the bones need to be frozen and then thawed, obviously, prior to being given to the dogs to reduce any parasites like bacteria, etc.?
Really good question and a lot of food for thought, mainly because bacteria will never get destroyed by freezing. Actually, most bacteria will not be destroyed by freezing. When it comes to parasites, if the bone has any meat on, it's preferably to be frozen before fed, mainly because of tapeworms. So the main reason why you're freezing your dog's meat or should be feeding only previously frozen meat is parasites such as tapeworm. It will not affect roundworms because they're transferred through feces, but when it comes to tapeworm, it is a really interesting cycle where the first stage after the egg is ingested by herbivore, the larva will migrate into the muscle and it will stay there. And if a dog or another carnivore eats the larva, it will develop into an adult tapeworm in a dog's intestinal tract. So that's why you should freeze it. You should freeze meat to destroy the larva of tapeworm. We often talk about freezing, but I never talked about the life cycle of tapeworm. So this may shed that. Another reason why dogs get tapeworm and cats get tapeworm is from mice. Actually, from not mice, from fleas. Fleas carry actually larvae of tapeworm as well, and they can develop into tapeworm. So parasites are super interesting, right? They have evolved using the animals as vectors and transport devices, and some parasites would even change the behavior of animals. It's really cool, really interesting. And even
Excellent.
fungi actually change the behavior of animals. You may want to read a book. There's an audiobook. I will look it up in the meantime on fungi and how they can actually affect the behavior of animals and insects. It's really cool. Nature is
Thank you
amazing.
for that. It is indeed. So we have a winner, and everyone was again very fast on the keyboard. So the winner is Terry McDonald with a pH of 2. Thank you very much, everyone, for your answers. Dr. Tobias, shall I add one more question here that everyone can, this will be for our third jar of Green Men. I'm going to make it harder though, because everyone's way too fast. They're paying too much attention. You must be doing something right.
Why don't we just let everyone choose what kind of green mint they would like if they're in the US?
Absolutely. If they're in the US, yeah, we can give them the choice for sure. Perfect. Okay, so the next question is Greenman, we've discussed at length, and Dr. Dobias did share a screen to show you Greenman and Greenman H+. My question is, other than calcium, which is a popular mineral that a lot of people think about when it comes to mineral supplementation, is there are 3 other minerals in Greenman that start with the letter C. So I encourage you to check out the website or the label on your jar at home and tell me what those 3 minerals are that begin with the letter C outside of calcium.
You guys, what do you think? Shall I let Alicia choose the questions because she's becoming tougher and tougher with us, right? But anyway, thank you, Alicia. This is really fun. And I will actually give you the name of the book about the fungi because it's super interesting. It's called Entangled Life, and I have it on Audible here. And the author is Merlin Sheldrake. Merlin Sheldrake. Sheldrake. And any questions?
Thank you. We already have a winner for the 3 extra minerals, or the 3 minerals that start with C outside of calcium. So congratulations to Hepatia. I think you were the first to mention them. And the 3 minerals that start with C outside of calcium are chloride, chromium, and copper. So thanks everyone for playing.
Chloride,
and
what else?
Sorry?
Chloride?
Chloride, chromium, and copper.
Oh yes, okay.
In
Okay.
addition to calcium.
I didn't understand the chromium. Sorry, yeah.
And we'll
Okay.
save the last prize for the end of our Facebook. Do you have more for the slideshow, or would you like to do
No, I
some
think that
Q&A
we're
with the
done
audience?
pretty much. I think that I've said everything that I wanted to say, but if you have any questions, I'm happy to keep answering them for a few minutes.
Okay, we have some more questions for sure. So thanks everyone. We've got a really lovely group of people that have asked some really interesting questions to do with bones, and it's lovely to see that everyone is so engaged and interested to figure out the best and safest way to feed these items to our dogs. So the first question is for, let's see, from Mary. Mary said, I am a raw and cooked fresh food feeder, but I've heard that kibble-fed dogs have an alkaline stomach. Can bones be dangerous or maybe less easily digested for dry food eaters? It's not something that I've heard before.
Yeah, really good question. I would say that in general terms, I would feed the raw bones at least 3 hours, actually maybe even 6 hours apart from the kibble, and then it should be okay. You will strengthen your dog's stomach, but I would not be mixing the kibble with the bone at the same time. So I'm going to be extra cautious here and say avoid fermentation or any other issues. Feed them separately, at least 6 hours separate from each other. The pH of the stomach, to be honest, I do not know. Most kibble are acidifying anyway. Alkalizing foods are greens mainly, and grain is acidifying. So I wouldn't say that the pH is a problem, but kibble feeding does lead to the stomach being generally weaker, maybe more inflamed, less likely to be able to digest bones. If you see that your dog doesn't do well on bones, you can try different kinds of bones. And if your dog gets diarrhea repeatedly or throws up the bones, you can try sometimes to add apple cider vinegar in your dog's food in general and improve the stomach environment. You can add digestive enzymes, but they will obviously not be as strong they're not acids, right? So if your dog's stomach is weaker, then you may not be able to feed bones. There is another point that I wanted to make. If your dog's stomach points, which are on the spine, are weak, and if they're affected, then the stomach itself may be problematic. And I will show you a chart here because I think that without that you may not know what I'm talking about. I'm going to search for stomach bloat, Peter Dobias, and look up the article and show you the picture. Okay. Um, I got it. I just need to share it. So this is from my blog on bloat that I would highly recommend you reading. So every intervertebral space, every space in each two vertebrae is related to a particular area of the body, and the space behind the last rib, right here behind the last rib, you can feel your dog's last rib when you start at the spine and go down with your thumbs. You'll feel it. That there's no other ribs behind that one. So if you go back to the spine and your dog is super sensitive in that area, that may be due to two things. That area got injured and there's muscle spasm by your dog slipping or sliding or somehow injuring that, or that the stomach or the pancreas is somehow struggling or is inflamed or not particularly healthy. So what you can do, you can actually massage that area. You can ask our chiropractor to work with that area to make sure that the energy flow and the blood flow and nerve flow improves. And what will happen, the stomach function will also improve as well, and the pancreas function will improve. If you think of the organs, they are supplied by blood vessels and nerves. And in Chinese medicine, we also acknowledge the energy lines. And if the spot behind the last rib is tight, it will result in the weakness of the stomach or vice versa. Sometimes it is hard to know what came first, but treating that particular spot is helpful in either case. In dogs that have long-term muscle spasm and issues, inflammation in that area, it ends up with this bridging, which is called spondylosis. And interestingly enough, stomach bloats often happen in dogs that have inflammation in that area, and also bridging and spondylosis. I talked to several emergency veterinarians who said that indeed they see this very often. So this is a side note, but a very important one. So going back, kibble and bones feed separately. I don't think that it affects the pH as much, feeding kibble, but feeding kibble is, I can recognize dogs that are fed kibble, not necessarily when they're puppies or young dogs up to 3-4 years of age, but once they start hitting 5 years and up, I will look at them. I will feel them within 15 seconds. I'll be able to tell you whether your dog is on kibble or not. It's very much different. You also will be able to see if a person eats McDonald's and junk food all the time or not. Like, you will see them at the gym or at the beach. You will be able to tell the difference. And it's not just body weight, it's general movement and quality of their skin and how they feel and breathe and so on. It's super important. But we get addicted to junk food and bad food for many other reasons. I will be actually writing about trauma and stress in the next couple of weeks. I think that I have a few pieces of information that I'd like to share, but if you want to know, just subscribe. I will leave you in suspense.
Sounds like a plan.
Super important information. I can't emphasize it enough how important it is to acknowledge our life experiences in the way of our addictions. Sometimes, people doctors go into dividing people, whether they're alcoholics or drug addicts and other addicts, sugar addicts, chocolate addicts, coffee addicts, and they don't really look at the origins of the trauma, which may be very different. And these addictions may be similar when it comes to substance abuse, but they're definitely not originating from the same cause. And this is actually one of the biggest failure of medicine and medical system. Anyway, I derailed a little bit, but we can go back to.
That's okay. Sure. We have some quick questions from the audience. One is from Barbara. Barbara said, why do you cut the nails off of chicken feet? That was mentioned on the slide.
Do I? I don't think so. I don't think so.
I think it's on the infographic to cut the toenails off of the chicken feet.
Oh my goodness, I have to talk to Julia. I never given her the instructions. So you can see that this sheet is a work in progress.
Work in progress.
Let me just check. I'll share this with you again, the slide. That is so bizarre. I never saw it. Where is it?
If you go up, yeah. So
Oh,
chicken or dog legs and feet with nails cut off.
I'm sorry, I've never seen that before. I didn't even notice that it was there.
So
I
no
see it
need to
now.
cut them off, I take it.
No, absolutely not. I'll be a little gross. I think that some people chew their nails and, and eat them. It wouldn't be a problem for dog. Dogs like to eat hoofs. Oh my goodness! If you get a dog to nearby a farrier that is, trimming horse hoofs or cow hoofs or whatever hoofs, dogs love it. Actually, it's perfect delicacy for them. It's like truffles for them, I think. All right.
Fun. Okay, so the next question is from Renee. Renee asks, what if dogs have allergies to most of the proteins that you mention on your chart? Should the bones of said proteins be avoided?
I'm allergies are kind of a tricky topic. I think allergies are the disease of the immune system and the gut. Ideally, the treatment should consist of such measures that will improve your dog's reactions and the function of the immune system. There are some articles on allergies. I have a rather non-conventional view of allergies. Quite often, it actually is not allergies that causes the immune system flare up or the body refusing certain foods or appearingly refusing certain foods. But go to the blog on allergies. You will learn more. There are also some videos I think on our YouTube. There's quite a bit of information. I I, I, I just learned recently that I wrote about 300 blogs in the last several years. I don't really know how I did it. I must have been sleepwalking, but it's there and it's for you to use, and we'll be improving them and using the information in different ways to keep your dogs healthy and keep you healthy and learn a lot. I love to learn too, of course.
Absolutely. And we have one more prize to give out. So perhaps I will throw out the last question to the audience and I will make it a little bit easier, even though everyone is completely rocking it so far. So the last question is, again, to do with Green Min, our product today that we are giving away as prizes via a coupon, and we will be in contact with all of the winners after Facebook Live. The question is, there are 2 ingredients in Green Min for dogs. Please tell me what the 2 ingredients are, and you can win yourself a jar of Green Min. And while everyone is typing their answers furiously on their keyboards, shall I give you one more question, Dr. Dobias, and
By the way, the
perhaps we can wrap
ingredients,
up?
yes, the ingredients have to be exactly as on the label.
Exactly as on the label or the website. Yes. Please and thank you. Okay. And the last question, let's see, is from Karen. Karen asks, how often in a week should your dog be able to chew on a bone to help with dental care?
Um, I usually recommend giving bone twice or 3 times a week. If it's an edible bone, then make sure that you deduct the weight of the bone with the other, from the food dose that you feed. Let's say if you feed your dog 500 grams or a pound of food and you give half a pound of bone, then you give your dog meat and vegetables, half a pound of meat and vegetables to kind of make it add up to 1 pound, right? So again, you have to deduct or subtract the bone weight from the meal. If it's not an edible bone, if it's just an entertainment bone, play bone, then you don't need to. Um, I would say for dental, twice a week. For food, 2 to 3 times a week. Um, yeah, that would be ideal. And again, you can do it less or more frequently, but I would probably not go over. Well, no, I would not go over 3 times a week because it can be too hard on the digestive tract. Um, you really need to understand that the raw diet principle is based on feeding the whole animal, and there's more muscles on the carcass than bones to a degree. So I usually recommend feeding about 25% bones of the full overall amount.
Excellent. Thank you. And we have another winner. So thank you so much for everyone participating. The first full answer that I saw that was correctly posted to Facebook was from Susan Taylor. So Susan, we will be in touch with you as well after the Facebook Live so that we can set you up with a coupon for a jar of Greenman.
And thank you, Alicia, for organizing such a great contest. And thank you, everyone, for coming here. We really enjoy being here. We really enjoy it because I know that it can make a difference in the lives of your dogs. I know how much you love your dogs. That's why you're sitting here. I know how much you try to find ways of extending their life and also quality of life and health. Um, they are such amazing teachers and they care about us, and we can be ourselves with them, which is another really amazing thing. Um, so stay tuned, subscribe if you haven't subscribed, share the information with others if you can, please. I would really appreciate it. And if you have any questions, you can always reach our customer service, who answers questions of anyone who asks them, even if you're not customers. So, and it can be about anything, but with one caveat, we do not provide medical advice. It is for information purposes only. And we do not discourage people from seeing their veterinarian. So anything that is seen here, if you decide to do any of that, it's at your own discretion. It's for information purposes only. Thank you so much for being here, and give your dog a hug for me. And take care. Bye bye.